Hello, anatomy and physiology. Today we're talking about anatomical positions. So this just helps clear up any problems we might have when we're talking about a body of a person, if we're talking about orientation of organs, if we're talking about a dissection that we might be doing on something. And we will be doing dissections this year. And those instructions will use anatomical position terminology. So we've got to be very clear on what we need. So the first term, you'll notice that the terms down here are kind of paired. The first term here is anterior and posterior. Anterior just means like towards the front, whereas posterior means towards the back. So you'll see the example though, my toes, if I'm standing up facing you, my toes are towards the front, and then my heel is towards the back. So that would be posterior. So you could say my nose is anterior, the back of my head is posterior. So anterior, posterior. Superior and inferior just means towards the head or towards the tail or bottom. So for example, my nose would be superior, my chin would be inferior. Okay, so it has to do with the placement of things up or down on the body. That's superior and inferior. Medial and lateral means towards the midline or middle or towards the outside. So my nose is going to be medial and my ears are going to be lateral. So anything that's towards the middle is described as being medial, and anything towards the outside is going to be lateral. Okay. All the examples we've given so far, I've used like my head as an example. Proximal and distal is specifically for limbs. We're talking arms and legs here. So proximal means that it's towards the body. So if I'm using my arm as an example, I have my arm right here. Okay. If I'm looking at my arm, where is it in relationship to the rest of my body? So just kind of looking at proximal and distal here, the proximal is going to be towards the shoulder. Okay, distal is going to be towards the fingertip. So my elbow is going to be proximal to my wrist because my elbow is closer to the point of attachment. Okay, for my legs, my ankle is distal to my knee because my ankle is farther away from the point of attachment than my knee. Okay, superficial and deep has to do with going like inside the body. So superficial means it's close to the surface, like my skin. Deep means it's down below, like maybe muscles or bone. Okay. So those are the main anatomical directions. On top of those directions, we also have body planes. So we have three different body planes: sagittal, frontal, and transverse. Sometimes the frontal is also called the coronal plane, but basically if you look at this diagram right down here, and this document is on your LMS, the frontal plane is going to divide you into basically a front side and a back side. The sagittal plane is going to cut you into left and right portions and actually can make a mirror image. And the transverse plane is going to cut you into top and bottom portions. So transverse, sagittal, and frontal. Now, just because there is a plane there does not mean that you have to do it in the middle. So you could have a transverse plane at the knees, you could have a transverse plane at the shoulders. So that it just tells you which direction the plane is going, not what area it's in. Okay, so you're going to use these, and you're going to actually make some flashcards with these terms. So they can use them to practice, and we will have practice quizzes over these terms, and we'll also have a regular quiz over these terms that will be really quick that we'll do more towards the end of next week. I think for our G1 group right now, the direction quiz is scheduled for August 27th, and for our GT2 group, that's August 28th. So you guys have a little bit of time to go through and study and get used to these. There's a lot of Quizlets and different things like that available. And as always, you can always hit me up during my office hours.